now I am left speechless as usual. And yes, he has said that I will be telling you more, but he's taken away all my jokes actually. We're going to talk about the sense in sex. Now you may ask, what is the sense about it? Or we've never heard of this, but we use all our senses in sex. Dr. Anup, you just tell me the sense of time. I always lose it, so please let me know where I'm going to be if I'm delayed. Today we are going to give you an overview of the sense organs and their use in sex and how you would understand the impact of these organs and use it maximally to enjoy the sexual experience. Now we use it as a part of therapy when we do sensitive focus in people, maybe males and females who come with sexual dysfunction. But this is something which we can use normally because it is to spruce up your sex life. So more sexual problems arise majority of the time because, yes, either of the couples may not have time for sex. We are seeing this currently now. आज नहीं कल करते हैं, जाने दो बहुत काम है. So our goals have changed, and sex is not one of them. So the time for it, or the commitment for it, is lower down, on the ladder. Now, if we have people with sexual dysfunctions and they are coming for treatment, the first thing they ask is, कितना time आना पड़ेगा? क्यों आना पड़ेगा? Wife को problem है, मुझे क्यों आना पड़ेगा? This is what the male would say. Or similarly, if you tell the wife, if the husband is having a problem, the wife says, no, उसको school जाना है, बच्चों को drop करना है, नहीं आ सकती है. This is a common excuse which is given. So the commitment part is not there because we don't consider sex to be important. Sex is something that needs to be done. For most women, it is probably just a duty to be performed. And yes, after you have a child, even that duty is not necessary. The communication patterns, Dr. Rao has given such beautiful examples of the communication patterns between the couples. And if you see that both are on a different page. So we have to understand that also. And this is in our normal lives too. None of us probably may be on the same page as our partner. And this causes a lot of heartbreak. Maybe your relationship may suffer because of that, but we don't realize that just changing this aspect can change or make our relationship much better. So the need for it is not understood by many, and when we try to tell them, yes, they try to make a change. But till we accept responsibility, this concept of self-construct or something like self-perception, that I am a sexual person. We all run away from this fact. Why? Because I cannot think of sex. I mean, I cannot call myself sexual. Why not? You have to first accept it from there. So when this perception comes, then the need automatically is realized. So in normal life, you will find that yes, couples do it in a mundane, routine way, and this is how we spend most of our time without, say, doing sex maybe once in 15 days, 20 days. There are recently married couples who do not have time for sex. I mean, it's very sad, and they would be the medicos who would be doing some super specialty in my hospital, and then they come for consultation saying that, not getting along. And in 15 days, people who were knowing each other for maybe 3 years, in 15 days, the wife leaves and says, I want a divorce. And this resident is like flabbergasted. I didn't know, 3 years we are together. It just happened a couple of months back. It's so difficult because communication is different when you are supposed to be in love, when you're supposed to be intimate, when you're supposed to be dating, going along with each other. The moment the marriage status comes, things change. This is what we are seeing, and this is what people suffer actually. So We are trying to focus on understanding this or the senses, which you can probably use in your own sexual life or your patient's sexual life and make the experience something exhilarating, sensual, maybe mind blowing. So, normally, if you look at the picture, somebody would want to do sex in a place which has good ambience. Compare that to your bedroom. Suppose it is in disarray. Suppose it is, things spread all over, untidy. The first signal which comes to the mind is not a positive signal. You know that at the back of the mind that this is not good, it's not clean, I don't know how dirty this is. So you cannot enjoy or have a positive experience when things are not as per your needs or desires. So it starts with that. So when you have a bed which looks comfortable, which is set properly, and yes, you take extra effort to sprinkle some flower petals and all, which is done in all our movies to tell us that it is important. All these visuals are given to us to understand. The mood doesn't set. The mood doesn't set for an activity which is personal, which is something which everybody enjoys, but which is also very, very private. So each of everybody has to take responsibility for their own sense organs to be involved in the sexual experience. We begin with touch because we have the first experience which we have when we come into this world is touch, when somebody touches you, holds you, cradles you, cuddles you. So as a child, as a newborn, we've been exposed to touch all our lives. We are blessed by having a body which is end to end with skin, which is the organ of touch. It's got nerve endings, it has got everything, which when stimulated give us a new experience. So yes, touch is the most important of the sex love experience. Touch is most important to make us feel secure, comfortable, relaxed, and all those things which only a touch can do. Now, early stimulation patterns, as soon as you have a baby in your hands, what do? You nuzzle it, you cuddle it, you stroke it, you touch the cheeks, you touch the palms, you circle the soles, you give furkis on the umbilicus or the navel, and you get a response. And what happens? And all of us have those memories. All of us have those memories because they got out pleasure. They made us feel nice. They made us feel good. So those are the early stimulation patterns by means of which it gets imprinted in our memory. But over the years, we kind of forget it. Now we will touch our children maybe till 10, 12, as long as they become adolescents. Then they say, I need my own space, please don't come and don't touch me. But doesn't mean that we can't hold their hands. I can't put my hand across their shoulders. I can give them a hug, maybe one embrace. And you will see the difference in those kids and kids who are not touched because parents say, no, he doesn't like, I will stay apart. So over the years, touch has reduced. And the next time we touch is when we get married. And for maybe 7, 8 years or whatever, give the time from adolescent to your marriage age, maybe max 10 years, you've not allowed anybody close. You don't want anybody to touch you, hold you in a personal way, or even kiss you or giving you pecks in the cheek. So our inhibitions come up suddenly. They do over time. And that is when we have a lot of problem in allowing a stranger, if it is an arranged marriage, so near you that you've not allowed your own parents to touch you or embrace you or hug you in in any kind of, loving way. Becomes difficult. And these are one set of problems which I see in girls who are having conversion disorders or present with a lot of pseudo seizures that they get, they find it very difficult to allow somebody near them. So automatic barriers kind of come about. So what I want to reinforce is that we all have these learned behaviors. Like when somebody holds your hand, when somebody strokes the back of your hand, when somebody strokes your back, strokes your cheek, what I had learned or what somebody had done to me before and which was a positive memory comes back and I start liking it. And these kind of learned behaviors, yes, of course, help in the development of your erogenous and non-erogenous zones. There are different cultures have different degrees of tolerance for touch. If you look at British, we always call them the stiff upper lip because if you look at the way their body language, the way they approach or even, they hold their women, is at a distance. So it is just like, one embrace and just you're out. Nobody's hugging them tightly or anything. It's just a peck on the cheek. The Americans are more comfortable in slapping the backs or just, holding the shoulders. They don't otherwise like upper body contact. Compare them to the Europeans who are very, enjoy embracing, enjoy hugging. Look at our own culture, very pro-touch, but pro-touch, same gender. You will see a number of guys hugging, holding on to each other, shoulders, putting their arms across the shoulders. You'll see women together, women even, giving pecks to each other on the cheek. Still, of course, a decade ago when the thing about homosexuality came and then the same sex culture and this display of affection kind of people started getting embarrassed to do it. But we are otherwise a very pro culture and we don't do it between the opposite gender, but at least the same sex gender, it is ongoing. Now, why do we want this? Because our culture is such that we enjoy touching and we should continue touching. It is one of the not to be taken every time in a sexual manner. Non-sexual touch or a touch which is just affectionate is equally emotionally binding to make you strong, secure, comfortable. So when we use it in the sexual, in sex play, touch definitely heightens the pleasure. It heightens both sexual as well as sensual pleasure. This is responsible for causing a psychological intimacy. And because of this, the non-erogenous zones, like the ones in your body which are the other areas which are otherwise not supposed to be erotic, suddenly become erotic. Most of the sex is done in this position, which is called the missionary position. Either of the genders can be on top. The only benefit of this position is that, yes, people are comfortable in lying down position. And in this position, you have body contact from head to toe. So you have the person who's on top also gets the benefit of the back being stroked, whereas a person who's lying down misses out on that kind of touch. As compared to other positions where if it is say standing, it is sitting on a chair, or you do a South Pacific position, you might find there is distancing. So wherever there's distancing and you're not using your hands or you're not using the touch, then obviously this heightening of pleasure. You want a person to have the desire, progress to arousal, be excited, and then have the orgasm. So it takes time in this. Now, when we look at erogenous zones, yes, we are all aware, universally, both the sexes have common erogenous zones, which would include your, genital areas, breast, nipples. Women also are more sensitive to the medial aspect of the thigh, the inner thigh, armpits, nape of the neck, throat, spine. Both the genders are sensitive to this. Males are more sensitive to the ear lobules behind the ear. Females more sensitive to the nape of the neck, the throat, popliteal fossa, back of the knee, ankle. But tell me which man in routine sexual thing goes down till there to stimulate the woman. Most of them don't even know their own erogenous zones. They're not even aware of, इधर stimulate करने पर ये अच्छा लगता है या ये मालूम होता है. Not to guys, no, because a woman has never touched a male otherwise. The only areas which she knows to touch is the penis and maybe his lips, maybe his breast, nipple, and the back. She doesn't touch anything, even buttocks. I would say that, squeezing the buttocks, men do that for women, but women hardly do that for men. So again, they're not aware of what kind of sensations can come and how, whether they are enjoyable, not enjoyable. So the thing is, when you touch an area, you stroke an area, there are of course different ways of touching, which we all follow. And if you do that, you have to communicate it to the partner. Now, genitals, everybody is aware that yes, are the most sensitive because of the nerve endings, and we know that touching the clitoris, touching the penis, taking it in the mouth, rubbing the clitoris, licking the clitoris brings about a lot of sensations. And many people want only oral when they have been exposed to that. They don't get enjoyment of the routine because this is, you get a higher degree of stimulation. Very few people try the perianal region, not many try. So, but it is equally rich in nerve endings and equally stimulating, and yes, gives you a while, it gives you a kick kind of if you would allow yourself to be stimulated. There are different ways of touching. Again, the most commonest thing which is done is maybe some, chewing. It is usually done by males. You have to tell females that even they can chew. Say they can chew on the nipples, they can chew. Because you will find a man doing suckling, doing licking, doing probing, but you will find a woman is very, very inhibited in doing touch. Touch doesn't have to be only with the hand, it can be done with your tongue too. And you have to use both these organs judiciously if you want to enjoy the sexual experience. The second sense organ which we are coming to is smell. Now, again, different smells bring about different effects, and we are all aware of that. I mean, some smells are so universal, like it brings about pleasure. Like if you have a baby smell, you remember the Johnson's baby powder, soap, everything. I mean, you may be old, but you will still remember it. Why? Because it is ingrained, imprinted. It is universally, everybody likes a baby smell. We all love the smell of the earth after the first rain. You or most of us like the scent of a red rose. So these are some of the smells which have been picked by us, which have been kept by us. And therefore, we say the sense of smell is personal. I mean, not necessary that if I find somebody odorous or I get an odor, that person gets the same odor. And if you look at males, they're always together. I don't know, if a female comes, she'll suddenly get the smell of sweat. And she'll find it intolerable to stand in the company of, the males. But you will find that all males are huddled together with that sweaty smell, not feeling anything. So this kind of thing like sweat is most often a put off. There are some which are very strong odors which a woman can't tolerate. And many times men don't realize that. Many times they don't realize that she's backing off because his mouth is smelling. We've talked about, we've heard about pheromones. Pheromones are seen in lower animals, and they are the sense chemical attractants which are released by these animals to show that, to signal the male that the woman is in heat, and so that sex can happen. It is given out by insects for kind of communication. So in humans also, it is said that a pheromone-like effect is there. Probably seen in olfactory priming, where women who are staying in a hostel room, 5 of them have different period times, but over a period they will all menstruate at the same time. So this is supposed to be the effect of the pheromones. So we have to understand that in humans, we try to cover up the natural smell of our body. If you look at a body odor, it's very clean, very fresh, and it is something which attracts. Both partners get attracted by that. It should be a clean smell. But we try to mask it. We try to use a lot of perfume, deos. We use a lot of cosmetic products, which when suppose the guy tastes, he gets some burning on the tongue and all, and so they avoid doing that. So all these things come in the way of the sexual experience because it prevents you from heightening that sexual experience. Now, capillaries are again present in our in perspiration, in vaginal secretions, and in semen. Musk is supposed to be very sensually exciting, and we've seen a lot of ads about that. The Axe effect. You have talcum powders. You have all these things to attract, the woman. The musk is supposed to be a male scent used used by men so that the opposite gender gets attracted. But many women prefer to use the musk smell because it is so strong, and she gets aroused herself. So, sir had given that example also. And if you look at what I would like to say is the cosmetic industry or whatever is there, we are all given a treat of all these ads which depict perfumes and scents and all that. But it is always the woman who comes out of the bathtub. It is always a woman who's using, a soap or using a powder. You don't see many male ads. So what has happened is that the women have not been sensitized to seeing near nude men, and as a culture, we don't ask them to talk about sex or think about sex or look at sex, etc. So there is this discrepancy where you will find that a guy gets turned on very easily if a woman passes by just with a whiff of perfume, which normally happens, which is shown in ads also, but it doesn't happen in real life. It doesn't happen. So somewhere we have to make use of this sense of smell, which is never used. So if you want to put a candle, which is a fragrant candle, you want to put a reed diffuser, it could be lavender, jasmine, it could be something which stimulates your senses. Yes, it brings about a better sexual experience. Now, again, men are not interested in putting candles and all that, and they are not concerned with fragrance. For them, it is only one task. They don't have any other goal in life. It is a woman who takes time to get excited. So if a woman takes time to takes time, because by the time the man ends, the woman has to still start. She's just getting her senses collected. So you see the time difference between the two. She has to prepare the room prior to doing this. I can just put one gajra or just some mogra flowers in one basket. They will do their work. You don't have to sprinkle it on the bed sheet every day. But the woman will feel nice because if she's olfactorily cued, all of us are cued in one or the other senses. We have to realize this because we have to tell our partner. So if I find I'm visually cued, then my whole focus is the visual. How is my partner presented to me? How is the room presented to me? But if I'm olfactorily cued, then I bother about smells. Then there should be sex hygiene. Means there has to be a bath taken by the couple before the sexual activity, because it is not only the sweat. There are many smells which we carry with us. Like if I go home, my daughter says, "Oh, you smell like a hospital." We don't smell it because we are continuously in that environment. But people who smell us after a time, and it's not everybody's cup of tea, or nobody enjoys that smell. The other smell is the smell of nitrogen. All of us go to the washroom 10 times a day. None of us, if we don't take a bath and you try a sexual act with oral sex, it is disgusting. You can't take the organ in the mouth if there is smell of nitrogen coming. And many men don't realize that. They force the woman to take the penis in the mouth, but they are not clean with the penis. It's just a small thing which people have to do. Maybe just take a clean bath, just apply soap, nothing, no powdering and all that. And you might find there's a better response to the sexual act. Plus, the kind of food we eat a lot of masaladar food. We have onion, garlic in everything, and they all stink. So either you brush your teeth or you take an aftermint, but you should see to it that you're not having an odor, because mouth odor puts the best of the best person out of that thing. So if you're trying to go close to your wife and you're thinking of alcohol or tobacco, she will move her face away. When her face is moved away, all her senses have gone away. her eyes, ears. She doesn't want to see you, smell you, or look at you. So it comes in the way of the sexual act. It is not a positive thing, but many don't realize. Men just finish the penetration and they're off, but the women is left unsatisfied. So it is very important that it is understood. So these are small changes which, if you bring in your patient's lives or the couple's life, make them understand, it works wonders. Taste. We come to the tongue. The tongue is the most ubiquitous of the organs. It has got sinuosity, granulosity. It is a wet organ. So the kind of experience you have with the tongue is like कमाल का. It's not the way you लेकिन वो कैंची के जैसे ही इस्तेमाल नहीं होता है. उसके और भी बहुत सारे इस्तेमाल होते हैं. You can use it to taste, probe, lick. Many women may not be comfortable with the saliva coming on them. You know, they are very. There are many men who are very, overt in their expression of desire, and they may lick so much. There is spit falling all over the face. Again, it is not light. So please be careful and take your partner into consideration when you're doing these acts. If she likes it, she enjoys it, she also wants the saliva in the mouth, yes, you're free to do French kissing as much as you want, where you share the saliva. Many women don't like it. Many women don't want the penis put in their mouth and the man ejaculates in the mouth and asks her to swallow the ejaculate. Because it is very difficult sometimes to swallow the semen as it is quite sticky. Again, it is a choice of the person. So you have to ask your partner if it is fine to put the penis in the mouth, let her stimulate the penis, suckle on it. You can masturbate outside or, have a vaginal intercourse. But you don't want to miss out on the oral sensation. Yes, everybody should enjoy their sexual life, but with permission. It is not that anybody can come and do whatever they want without permission just because ye mera hak hai. So all our organs have different kinds of tastes, and if people are doing kinky sex, they would like to use, there are things where to make your sex life more spiced up, you can take chocolate syrup, I can take ice creams, jams. I've got patients who've done things, honey, spread it, wherever you want to spread it. You can spread it on the navel, on the lips, you can spread it on the cheeks. Breast is a common area of spreading, and then lick it off. So people enjoy doing that. Yes, of course, you have to take care that your bed sheets and all that are cleaned later. Otherwise, you'll have a lot of ants coming there to, lick you as well. So that is what one has to understand. Visuals. Again, visions, the most, I would say, second most important sense organ in your sex life. Because अगर मैंने देखा तो मुझे इच्छा हुई, मैंने चाहा, मुझे अच्छा लगा, वो तभी होता है. Like I said, we have a lot of societal rules of modesty. तो हमको कभी सिखाया नहीं गया था. Means our parents बहुत गर्व से कहते थे, my mom. मैं कभी अपने पिताजी को आंख में आंख डाल के नहीं देख सकती थी. मेरी नजर हमेशा झुकी रहती. So ये नजर झुकने के कारण, no, we forgot to see the man and his body parts and appreciate them, and we never got to see them. Whereas a man had all the right to see at the female and stare bluntly, stare so bluntly that a woman would get embarrassed, but a man wouldn't. So these different rules, fortunately, are changing. And now if you look at the other generation, our kids, if you look at them, none of them follow that. It's a good change. Darkness was always used with the cover up. Set करना है मतलब उसके लिए समय सिर्फ रात का है. अभी ये किसने बोला मालूम नहीं. Sir बोले कि afternoon is the best time. Excellent. It can be done any time of the day. Early morning is fabulous. You begin your day with a good sexual workout, and you find you're very good in doing your task. बहुत फटाफट complete होता है. Meeting में बहुत ध्यान रहता है. And yes, it is being seen. It is documented. Research has shown early morning sex is the best thing. Now, if we look at a normal normal Indian household. सुबह का टाइम 6 बजे दूध वाला आता है, पेपर वाला आता है, ये करने का है, वो करने का है, स्कूल का बस आता है. So even if the husband wants to and is pulling the wife and all that, आपको सिर्फ यही यही चाहिए, आपको टाइम नहीं, आपको समझता नहीं है क्या? बस मिस हो गई तो कौन लेके जाएगा उसको? So though it is 5 minutes, 7 minutes max, we cut out the foreplay in the morning, but we don't do it. Nor do we find time. I mean, they have time, but they will not make that time because we're so caught in by these rules or structured day, which we only have made. Sex done with closed eyes, yes. Sir has given an excellent example. I always tell people, please open your eyes if you can. See, if I get a good visual, I see the man enjoying, I get a kick myself. We want to go in back in our own world, focus, concentrate, have my fantasy, because जिंदगी भर मैंने कभी आंख खोल के किसी को देखा ही नहीं है, तो ऑब्वियसली जब भी होगा तभी भी मेरी आंखें बंद ही होगी. पर कभी तो आंख खोल के देखिए. This I tell the ladies. Men always have their eyes open, but men also close their eyes because I think each one wants it to be a personal experience. So we always, now people who have a problem with the wife, they always tell them close. Imagine you're doing it to Karina. You're not doing it to your wife who's got a tire and you don't feel comfortable. So in those cases, you have to tell them that. So, but overall, yes, if you do it with eyes open, it enhances your own sexuality. And you can come to know whether a person is liking it, not liking it, especially if I'm touching and I get an expression, I know what is happening with a person. Many times we are a reticent culture, मतलब हम बातें भी बहुत कम करते हैं. तो यहाँ पे आप bright light मत लगाओ, but you use dim light. There's so many options are there. एक ही fragrant candle लगाया, वो डिम लाइट भी देती है और खुशबू भी देती है, काम बन जाता है. उसी को फूंक मार के बंद करने का एक कैंडल 10 दिन चलेगा, इतना जल्दी वो नहीं करता है. So you have to tell this, and I tell this to patients because they tell me कैंडल किधर ढूंढने को जाए. I said भाई ये तेरे रूम में उधर से ही पहले से रख, 10 दिन चलेगा, उसके बाद तो बदल दे. But this has to be told. You can use moonlight. Preferably we say don't do it in stark light, tube light. Why? Because it shows all your faults. मतलब मेरे को इधर दाग है, इधर ये है, उधर वो है, मैं बहुत मोटा हूँ, मेरा हाथ इतना जाड़ा है, मेरे थाइस कितने मोटे हैं. Stark light enhances your faults. I do it in dim light. It is shadows. Shadows create mystery. It's like peekaboo, ये क्या है, वो क्या है. That way, of course. And partners who are visually cute like to see each other. So also, we like to have a good ambience. अपने यहाँ पे बॉलीवुड में इतना पैसा वो सुहागरात के लिए खर्च करते हैं. वो तो दिखाते तो नहीं है, पर विजुअल्स आपको इतने आते हैं कि आपको लगता है मेरी सुहागरात चल रही है. मतलब it excites you, entices you. So remember billowy curtains, satin spread, dresses which just fall off. Imagine तुम्हारे घर में वो पर्दा जो बेडशीट के जैसे ही दिखता है, तुम्हारी बेडशीट कॉटन वाली ही है, वो कुछ नहीं करती है तुमको. इट डजंट गिव यू अ गुड विजुअल. उसको टच करके भी कुछ नहीं होता है. तो आई हैव मेन हु टेल कि वाइफ वही फेडेड गाउन में रहती है. यू आर टेलिंग मी आई हैव टू गेट अराउज्ड. होता नहीं है मुझसे. Men are very visually cute, so anytime you ask them, they want only one thing, यही है उनका काम. औरत को पूछो, एक तो वो तिरछी नजर से देखती है, वो देखती है तो भी सही देखती नहीं है, ऊपर से उसको उसके the linguistic and that right brain वाला जो एरिया है ना, उसके डिमांड्स बहुत ज्यादा होते हैं. तो डिफरेंसेस जो सर ने बताया ना, वो बहुत अच्छी तरह से बताया उन्होंने. मैं सिर्फ ऐसे ही बोलूंगी कि वेरी डिफिकल्ट टू प्लीज वुमेन. वो मैन के तरफ देखती नहीं है. So I will give it to the male gender. They observe, they look. Women don't do that. Fantasy is important because it is to be used in your area. It is your private place. You can get good signals. You can masturbate, you can stimulate, you can have an idea about your own erogenous zones. So, female fantasies, male fantasies, we have seen the differences in the rates of masturbation 40% of females compared to 90% of males. So, fantasies can be, women always want an emotional based fantasy. It's like, अच्छा आदमी एक ही आदमी वो बोले because women are actually serially monogamous मतलब एक टाइम पे एक ही आदमी के बारे में सोचेंगे और मेल इज polygamous मतलब उनको कुछ फर्क नहीं पड़ता है so a woman will not let go of that most of the time it becomes a faceless fantasy after some time she may begin with a husband's picture in mind but it then fades off which it normally should only so that is how it is. Now we come to hearing hearing is yes again communication is excellent it should be there in every relationship. Like Sir said, whole day there is, nagging, 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 nagging. When he comes at night again, you expect her to communicate. And what is the communication which is happening? कल खाने में क्या चाहिए? लाइट का बिल भरने का है, ये बिल भरने का है. So if I tell them, please talk to each other, please talk some words which are, which will enhance love making, they are at a loss. So women who can talk so much, if I tell them, tell some nice things to your husband, like अच्छे दिख रहे हो या खुशबू आ रही है ये आ रही है वो नहीं होता है. Men are okay with it. Men can do it because all their life they're doing that only ना. तो बहुत सुंदर है यार तेरी जैसी कोई नहीं है यार बहुत. So it comes very easily to them. Women get tongue tied. मैं कैसे बोल सकती हूँ? वो नहीं बोल सकती. You have to train them. So I tell them sometimes कि ठीक है आप नहीं बात कर सकते हमारे पास fortunately I feel that Bollywood has given us so many things. It's given us songs also, songs with meanings, जिससे हम मैं क्या feel कर रही हूँ आपको बता सकती हूँ. So same thing I told, I was taking a refresher course for my batchmates, females only, but I was taking 4 years back, and they were very angry. They said you're telling us to use senses at 45 plus when we are now menopausal और इसका कुछ फायदा नहीं होगा. And they said, and I told them, you can use music or even you can sing the song. They said, क्या बात करती है? ऐसे कौन गाना गाने लगता है रात में? I said, nobody is telling you to sing songs. I'm just telling you to say one line. I said, ऐसा होता नहीं. I said, क्यों नहीं होता है? आओ हुजूर तुमको सितारों में ले चलूं. तो सितारों तक पहुंच गए मतलब ऑर्गेज्म की तरफ पहुंच गए. अभी आपको क्या बोलना है? आज जल्दबाजी की जिद ना करो यूं ही पैरों में तैरते रहो बस. And why is it not possible? If I can sing it, so can you. So this is what we have to tell them. The other two senses which we overlook, a sense of gravity and the kinesthetic sense. Like I told you that most of us are comfortable in the lying down position. You can do it in various, your Kama Sutra will give you hundreds of positions, but you have to find your comfort level and how you can do it. Water beds, doing it in the bathtub, doing it in the swimming pool, again, is something which is enjoyed by many. If you like it, if you have a bathtub in your home, please do value that bathtub and use it for this at least. But otherwise, I find it's a waste of money. The kinesthetic sense is the side-to-side rocking movements and in and out rapid thrusting movements. As a fetus, we've been used to this when we were in the amniotic fluid. So somewhere it is there in our brain. This kind of movement. So you don't feel dizzy, giddy, etc. Suddenly you have your these movements happen to you. Or what is seen or what we read in books, he suddenly dragged her and pushed her down and all that. ऐसा तो हमको postural hypotension होगा पर इनको नहीं होता है. So we are used to this, we can do this, but we don't use it. We don't know it. So please try to make each sexual experience a novel experience. Doesn't take much. Whole act lasts for 5 minutes. It is the pre-act, that is the foreplay, that is the main thing which enriches your sexual life. Please give time for that. And that is where you have to use your sense. The rest of the work is done by your brain. Thank you.